since we already know it's very effective to add blinatumomab to first-line treatment, we do it in MRD positive setting. It's reimbursed. And recently it's approved for also in MRD negative in consolidation. What we did in our study is to add blinatumomab very early on in the treatment, so already in the prephase. And by doing so, we hoped to have a very early CR and a very early MRD negativity rate. So that was our aim. We added 2 weeks of blinatumomab to prephase and 2 times later on as well, adding to the chemo backbone, so no substitution. And what we saw is that already after the prephase, 63% of the patients was in complete remission without any chemotherapy given. And the half of these patients were MRD negative, 53% of the 63% of the patients in MRD in CR. So that was a surprising and good results. Of course, we were curious whether there was a lot of toxicity due to the high tumor burden. You give blinatumomab up front, but CRS grade 3 was only seen in around 5 patients in total. Higher grades were not seen. And also the same for neurological toxicity. So yes, it is safe to give it already up front in first-line treatment. So the second question was the MRD negativity rate later on after the consolidation phases also improved? Because that was our primary endpoint. And yes, that was the case. All but 2 patients became in CR after the consolidation, and 91% of all the patients was MRD negative. And that resulted in an absolute better outcome than we're used to. So in patients up to 40 years of age, the outcome, the overall survival after 4 years, the follow-up is 43 months, was 86%. And for patients above 40 years of age, we know that is a bad group, age-related, was 50%. So we compared them to our former study, and that confirmed that it is improved. Surely that's unmatched, but it gives an idea about the improvement by adding blinatumomab so early on in treatment. And therefore, I think it's a successful study. It shows that you can give blinatumomab early in the treatment course, which results in a quick CR and a high MRD negativity rate, resulting in a better outcome.